Thank you so much for joining us today. My name is Judy Talley. I'm with PMD Alliance, and here with Kelly Merkel, who we together will kind of handle the technical and the PMD Alliance side of things. And of course, you're all here to hear from Beth Peterson, who is our speaker today. She's got some great things planned for us. I'm really excited to see what she has. I think you'll find it not only informative, but very interesting and inspiring too. So it's going to be a great hour. I want to bring up a couple things. First of all, when Beth is speaking, we're going to mute all of you. And that way you don't have to worry if your dog barks or if Amazon knocks on the door. You'll be muted, so you won't have to worry that you're interrupting anything. At the end of Beth's presentation, we will open the program up for comments and questions. However, what really works well is at any time during the presentation, but Beth's talk, you can use the chat feature at the bottom of your screen and type in a question or a comment. And then at the end, if those questions or comments maybe haven't been answered, we'll pick those up and do what we can of them. Often we aren't able to answer all the questions that we receive, but we'll see if we can work through some of them anyway. The program is being recorded, and so you all will be able to look at it again or tell people who maybe didn't see it today that they can look at it on our YouTube, PMD Alliance YouTube channel. Give us a couple days to get it up, but then it will be there for you to access anytime you want. So with all of those comments out of the way, I want to introduce you to Beth Peterson. And she is a speech language pathologist or speech therapist at LSVT Loud, which is a program dedicated to helping people with Parkinson's to make the absolute most out of their voice and communication skills. So Beth, she is not only an instructor, but she manages the ongoing webinars that LSVT Loud offers for professionals and the public. So Beth, I'm going to turn it over to you to tell us more and just get us into this great topic.
All right, great. Well, thank you to Judy and Kelly and PMD Alliance for having me here today. I'm very excited to be presenting on a topic that's a great passion for me, which is speech treatment in Parkinson's disease. So I'm going to go ahead and show a slideshow to help us kind of follow along. And I'll just kind of walk you through the slides here. As Judy mentioned, I am a speech language pathologist and I work for LSVT Global as an LSVT Loud faculty instructor. So I train other speech language pathologists in the LSVT Loud method of treatment delivery, which is designed for individuals with Parkinson's and has since been applied to other neurological conditions as well. I've been a part of the clinical research team since 2009, so I'll share some of the research that's been done on LSVT Loud a little later in the presentation. And then I also manage our ongoing webinar program, so we invite you to also participate in our webinars. We host them usually about every other month, and we have a large on-demand webinar library on our website. So feel free to tune in to those webinars also. We talk about issues pertaining to Parkinson's with voice and speech and also mobility. We talk about the LSVT Loud speech program and then also the LSVT Big physical and occupational therapy program. And then just in terms of a disclosure, I'm an employee of LSVT Global and receive lecture honorarium from LSVT Global. I want to go over today's talking points so that you know what to expect from the presentation today. I'll start by describing some communication and cognitive changes that can occur in Parkinson's disease. Then I'll summarize some key concepts of an evidence-based voice and speech treatment approach, LSVT Loud. I'll also highlight the research that supports LSVT Loud on the entire speech production system. And then at the end, I'll identify and kind of walk through some additional strategies and resources that can help to improve communication and cognition in Parkinson's. So to begin, just with kind of an overview with Parkinson's, research is showing us that up to 8 million people worldwide are currently living with Parkinson's, and that number of people with Parkinson's is expected to double by the year 2040. So our mission at LSVT Global is to empower those with Parkinson's to restore and maintain their highest levels of function with communication and mobility and independence in daily living through our scientifically supported therapy program. So as I mentioned, the LSVT Loud speech therapy program, so that's delivered by trained speech language pathologists who all go through advanced training before they're certified. And then the LSVT Big is the physical and occupational therapy approach that helps with movement. And those are also physical and occupational therapists who have gone through some additional training. What's really exciting right now, that's been more recent, is that rehabilitation programs, so speech, physical therapy, occupational therapy, they're all becoming more routine part of management in Parkinson's. So you have your Parkinson's medications that you may take. Some of you may have DBS surgery, and then we're also with that including speech, physical, and occupational therapy, because we're also seeing that exercise truly is medicine. So the research is showing us that these exercise programs should be part of your management in Parkinson's. And it's exciting to see that more recently it is being incorporated into that general management. So to really open up, I think it's really powerful to watch this before and after video of a woman who went through LSVT Loud. So at the time of this video, she was 59 years old. It was 2.5 years after her diagnosis. And she noticed changes and others noticed changes in her voice and speech. She's on medications in the before and after video, and there were no changes in medication across the month of treatment. And she completed this intensive 1-month speech therapy program. And I'll get into more of the details of that program as we progress, but I think it's just so powerful to really see her up front to see what kinds of changes that, that you may be able to expect. So let's go ahead and play that video.
Have you noticed any changes in your speech or your voice that you would associate with Parkinson's?
Yes, I don't speak loud enough a lot of times.
Anything else?
Hoarse.
Uh-huh. Anything else?
I stutter, which I never did before.
Do this for me if you would. Take a deep breath and say ah for as long as you can.
Ah.
Good for you. Okay. Would you say Parkinson's disease has caused you to talk less?
Yes,
Because?
because I stutter and then I can't be heard. If there's noise in the house, like when the kids come over, nobody pays attention to it because they can't hear me. Till I get mad and then yell.
Take a deep breath and say ah for as long as you can. Have you noticed changes in your speech or your voice as a result of the speech therapy?
Oh yes.
What have you noticed?
I talk louder. I think louder. I'm going to sing with the Sons of the Pioneers one of these days with my voice.
Good for you. That's excellent. What practicing do you do at home?
My ahs, my highs, and my lows. And I read out the mail out loud.
Excellent. Do you feel like practicing helps?
Oh yes.
Okay. Do you feel as though people can understand you all of the time now?
Majority of the time, unless it's my husband, and he'll say, "What? I can't hear you."
Good for you.
But I think he does that just to be cute.
I think he does too. Has anyone commented that it's easier to understand you now?
Oh yes, I set some of our friends back when we went to their house and I talked loud. Lou says, "What the hell happened to you?" My daughter said, "Oh, Ma, that's you?"
Isn't that good? Don't you feel wonderful?
Oh yeah, because now she can't say, "I didn't understand what you said."
Right? No excuses, right?
Yeah,
That's
no
right.
excuses.
All right. So what do you do when you want to be as easy to understand as possible?
Think loud.
All right, so I hope you were able to see and hear some of the changes with Shirley. This was Shirley. I think the most obvious is that her loudness and quality definitely improved. One thing that really stands out is also her confidence. So even though the treatment only was focused on loudness, we also see that spread into confidence, and she's just overall more confident. You can see she's expressing more joy. She seems happier. So we have that loudness improvement. You may have also noticed some improvements even in articulation and facial expression. So we'll talk later in the presentation about how even though the focus is only on loud, we see this nice spread of effect into other areas of communication as well. So where did we begin on this LSVT Loud journey? So it all started in 1987, and this on the screen is Mrs. Lee Silverman. And so she is the LS and LSVT, so Lee Silverman Voice Treatment. And Dr. Lorraine Ramig, who's one of the creators of this treatment approach, met her and her family, and their one wish for her, even though that she also had mobility challenges and other challenges occurring, was if only we can hear and understand her. So Dr. Ramig worked with one of her students on developing this protocol that is now referred to as LSVT Loud, so the Lee Silverman Voice Treatment. And this slide shows you the 30+ year journey into the research development of what the treatment is here today, beginning back in 1987 with more of that kind of pilot studies, just initial studies to see, is there any type of treatment that we can put together to see if it will work? And then going into phase 3 research, including the randomized control trials. So those are the bigger studies where the participants were randomly grouped into different treatment groups or untreated groups to see, does the treatment make a difference when compared to either those who don't receive any treatment or a different treatment. And then in phases 4 and 5, how do we disseminate this information and spread this treatment more now that we've shown or seen how well that it works from these randomized control trials and other studies? How can we get it into homes and all throughout the world? So this goes into more of that clinical implementation and how we train our clinicians and how to do the treatment, some technology to also offer other methods to receive the treatment. So we'll walk you through some of those in this presentation here today. So I'll talk you through some changes in communication and cognition that you may have noticed or are unfamiliar with, but that often occur with Parkinson's. So in terms of the speech, so over 89% of individuals with Parkinson's worldwide do suffer from voice and speech disorders. A lot of times this occurs in the form of reduced vocal loudness or mono-loudness, maybe some hoarseness like you could hear with Shirley, more of a monotone voice, so not many changes in pitch, and imprecise articulation. And these can occur early on in Parkinson's. There's also cognition changes that can happen with Parkinson's. So 20 to 43% of people with Parkinson's have some degree of cognitive impairment when they're diagnosed, and the prevalence rate of Parkinson's dementia is 28 to 41%. So in developing and researching LSVT Loud, these changes in cognition also play a role in how the treatment is delivered. So those changes in cognitive function can affect communication. So some things that you may notice are slower thinking, which can result in a slower processing time. There also may be some language delays, so delays in word retrieval or shifting kind of communication set, difficulty initiating or expanding on ideas. So that slower processing combined with levels of distractibility can lead to a loss of a train of thought, making it more difficult and potentially more frustrating for both the one speaking and the communication partner. So these were some things to consider when developing the treatment approach, and then also just in general in helping with communication with those with Parkinson's. So sensory processing deficits also contribute to speech difficulties. So those small or slow movements that are part of Parkinson's may be perpetuated by abnormal sensory feedback. So this can result in reduced awareness of vocal loudness deficit. So oftentimes those with Parkinson's think that they're speaking loud enough. They don't think that their voice is too soft. And therefore there's a lack of self-correction because they don't think that they're not able to be understood. And if you do ask those with Parkinson's to get louder, even if it's just bringing them up to within normal limits loudness, it feels too loud. So on the slide here, you see a picture of this woman, and this is a common response we get. I feel like I'm shouting if I talk like that, and it just feels too loud, even though it's just a normal loudness level. Now, we do find that they respond positively to an external cue. And so if you ask someone to get louder, and we see this often in our treatment room during evaluation, we'll say, tell me that again in a loud voice, and we get that volume up. There's difficulty with the internal cue to self-correct. So through the process of treatment, it's also important to develop that internal cue so those with Parkinson's realize and know what it feels like to use that louder voice so that they'll do it without the need for an external cue. We're also seeing that those with Parkinson's don't spontaneously maintain or adapt to treatment techniques without intensive treatment with a sensory focus. So we'll learn today that LSVT Loud is intensive in its delivery, and then there also is that sensory focus to again make sure that the person with Parkinson's is able to take that loud voice outside of the treatment room. So what is the impact of these speech changes on those with Parkinson's? So even those that are clinically asymptomatic, so they're not seeing or others aren't really reporting a lot of speech deficits, they still are reporting feelings of embarrassment, social stigma, and social isolation due to speech concerns. So does this matter? And yes, the consequences can include feeling excluded from conversations or a loss of dignity or feelings of misery for many. So there's research showing some of these types of feelings, and then a quote, if I have no voice, I have no life. So this is a big motivation to help empower individuals with Parkinson's to take back their voice. And so we'll talk about how that can be done. So we're also seeing that pharmacological treatment, so the medications that are being taken to control symptoms of Parkinson's are not providing any type of relief or improvement in symptoms of voice and speech. And also the DBS, so the surgery treatment, that's also not improving voice and speech. So those types of kind of interventions, while important for Parkinson's management in general, are not contributing to any improvements in voice and speech, so something else needs to be done to help with that. And back in 1987, when the treatment was being developed, there was no effective voice and speech treatments for Parkinson's. So the thinking used to be, if a person came into the treatment room, any of the improvements you saw in that treatment room would be lost on the way to the parking lot. So we'll talk today about how intensive treatment can help maintain those gains from the treatment room and transfer them out into everyday living. So the LSVT Loud key concepts are here on this slide, and they incorporate principles of neuroplasticity. And so that neuroplasticity are changes in the brain. So what needs to occur to actually make changes, not only at the behavioral level, so the voice and speech that's being produced, but also at the level of the brain to make those lasting connections and changes. So first, treatment's administered in an intensive manner to challenge those impairments. So it's 4 days a week for 4 weeks. Each session is an hour long, and there's also homework all 30 days of the month of treatment. And then we have 3 key concepts. We have a target of amplitude or vocal loudness, and that's the only target of treatment. So again, you saw that spread of effects with Shirley into other areas of communication, but the focus of treatment is only vocal loudness. The mode of delivery is intensive and high effort. So it's intensive across that month of treatment. And then within each session, it's high effort. So we're really working patients to those high effort levels. And then there's this concept of calibration. And that's that generalization of getting this new loud voice outside into daily living. So calibration is going to address those barriers to generalization that include that sensory disorder that I mentioned, internal cueing deficits that can occur, and subtle neuropsychological challenges that can make it difficult to maintain that loud voice. So that calibration is a big component of treatment to again make sure that treatment lasts after the treatment month, or I should say the gains last after the month of treatment and beyond. So I'm going to try a little exercise here, and it's fine that you're on mute, but I'm going to have you speak. So even though we won't hear you, I want you to just feel what this feels like. So here on your slide, we see someone speaking in a soft voice. And so at home or wherever you are, I just want you to say, "Good afternoon, Beth," in your normal voice. So good afternoon, Beth. Now I want you to think loud, and your loud voice, I want you to say, "Good afternoon, Beth," and I want to hear it even louder. So I'll give you a moment to try that. All right, so without even thinking about all the different things that your body was doing, by only focusing on that loudness, what we're seeing here is a spread of effects. So you automatically took a deeper breath. You automatically sit up. We're sitting up straighter. Your mouth was open more of your articulatory muscles were moving, and out came louder, more intelligible speech. And that's really neat with just this one focus on loudness to have that spread of effects into the entire speech production system. So then that second key concept of intensity we'll talk about here. So again, the treatment's delivered 4 consecutive days a week for 4 weeks. They're 1-hour sessions, and it's individual treatment. There's also daily homework practice for all 30 days of the month, and then daily carryover exercises as part of homework. Those carryover exercises are assigned by your clinician, and they're kind of mini exercises for you to take your loud voice into a situation that you would be doing that day anyways. And we also want to get you into a lifelong habit of continuous practice. Because just as if you train for a 5K or 10K or whatever race you did, if you stopped running as soon as you finish your race, there's no way you'll be able to maintain those gains in fitness or endurance that you did when you were training. So then we get you into this lifelong habit of practicing those exercises with your voice so that those changes will last over time. Now, there's also intensity within sessions. So we work patients to high effort levels. So we get them loud, we get them going for a long time. We work on harder reading materials across the weeks. So we train with multiple repetitions. We work to a healthy fatigue. So we're always working that intensity and high effort every single session. And then that calibration concept. So this again addresses the problem that people with Parkinson's feel too loud when we just normalize that volume. And so we have that single focus of increased amplitude via loud. So that's all our patients have to think about. This simplifies the cue for patients. I know I mentioned some of those cognitive changes that may occur with Parkinson's. And so only focusing on loud allows them to just focus on that one cue, even though they're automatically making all these other changes across their speech production system. But the focus is simple and only on loud. And this can improve the efficiency of treatment via the spreading of effects. So instead of going home and thinking, okay, I need to take a deep breath, I need to sit up straight, I need to over-articulate, I need to be loud, all you have to think about is being loud. And we're seeing that whole spread of effects from just that target. And so we also make sure that the treatment activities are salient. So that means that they're meaningful to those that we're working with. So we figure out what their hobbies and interests are so that we can embed those activities into treatment. We also have some naturalistic cognitive and linguistic activities that are also embedded throughout the treatment exercises. So you may be thinking, that sounds great. You get these nice loud exercises that you work on, but I'm not going to go out and say, ah, in my loud voice. And so, yes, we think of these treatment exercises as the building blocks. So we do we'll break these down, but we do a long ah, we do a high and low ah. We do those exercises in treatment with the treatment goal of a louder voice into conversation. And that real kind of overarching goal of speech treatment is to help you regain self-efficacy. So if we look here on the left side of the slide, we have this kind of negative cycle before therapy, where we're seeing that softer voice contributing to less success and confidence because there's concern about that softer voice, and then more withdrawal from social situations. So what we want to get to is after therapy, we have that louder voice now that's been trained through those salient intensive exercises. So now we're seeing more success, so more participation and less withdrawal. more confident in communication, and more engaged in activities of daily living. And so that's what we want to get to, that second cycle. It's a positive cycle that we want to be in. So the elements that we've seen need to be there for a successful speech treatment are that focus on that voice or that vocal loudness. It needs to be an intensive mode of delivery, because the past research showed us if it's not intensive, then nothing carries over outside of the treatment room. There need to be multiple repetitions. It needs to be salient, so motivating and personalized to individual patients. It needs to be complex in terms of always challenging patients. So when we train our clinicians to do the treatment, we train them to recognize, okay, your patient has this part nailed, here's how you can make it more challenging. So it's always high effort, always challenging every single session throughout all 16 sessions. And then again, we're retraining that sensory system to calibrate our patients to be able to know the amount of effort and feel the amount of effort it takes to use that loud voice so that they can use it outside of treatment. So what does an LSVT Loud treatment session look like? The first half or first 30 minutes of every session are the daily exercises. So they start with a maximum duration of sustained vowel phonation or long loud ahs. So ah. So we have patients practice this with healthy vocal loudness for at least 15 repetitions. And then we do some high and low ahs. And we do 15 repetitions of each of those. So a high might sound something like ah, and a low would be the opposite way. So ah. Those aren't as long as patients can go. We just hold that pitch for about 5 seconds. And then we have what are called functional phrases. So these are phrases that patients say every single day, and we practice them in treatment so they become very, very overlearned. And we'll have patients come up with 10 phrases to practice that new loud voice. So that's always the first half, the first 30 minutes of every session. Then the second half are what we call the hierarchy exercises. So these are structured, personalized reading and spontaneous speaking exercises that take up the second half, and they build in complexity across the 4 weeks of treatment. So now we take that loud ah voice and work it into reading and speaking scenarios. So we'll start with words and phrases in week 1, then progress to sentences, and then more continuous reading like paragraph reading, such as a novel or magazine article. And then week 4, we use that loud voice in conversational practice. As I mentioned before, all 30 days of the month, so even days when you don't work with your therapist, there's homework and carryover exercises assigned. So now what I want to do is do a brief demonstration so that you can get a feel for what these exercises are like. So I'm going to have you follow along on your screen, and I'm going to take down the PowerPoint in just a minute so you can really focus on me and my models, and then I want you to try to do these exercises at home. So if you have water, I'm just refilling my water here too. Grab your water so that you can have some sips in between the exercises, and we'll see what these exercises are like. Okay, so I'm going to start with some long, loud ahs. So I'm going to go first, and then I want you to try it at home. We'll do about 3 of these, and we'll do them for about 15 seconds each. So I'm also going to pull up a timer so we can time these. And if you can't hold it for 15 seconds, that's okay. Stop when you need to and then come back in. Oops. All right, so I'm going to show you the first one. So it should sound something like this. Ah, and you would keep going. So I'm going to count you down, and I want you to try this wherever you are. So we'll try 3, 2, 1, and go. Keep going. Good, keep going. I'm seeing some nice loud voices, and we'll stop. All right, we'll try 2 more like that. So I want you to do it again. So just like me, we'll do 3, 2, 1. Keep going. Keep it loud. And stop. Good. And let's try one more. So we'll do 3, 2, 1. Yep, keep going, keep it loud, keep it there. And we'll stop there. All right, so in therapy, you would do a minimum of 15 of those. And your therapist will just work with you to help you get the most efficient, the best sounding loud voice for you for that day. And you'll continue to improve that throughout the 4 weeks of treatment. So the next exercise, we'll do just a few of each for the highs and the lows. So for the high, you're going to start with your loud ah, and we'll go high. So I'll do one first. So we'll sound something like this. Ah. So we'll go ahead and try a few of those. So I'll count you down. We'll do 3, 2, 1. Ah. Okay, great. I like seeing all these faces practicing there. Let's try another one. Ah. Good. And we'll try one more. Ah. Okay. And let's go ahead and try a low. So the same thing, start with that nice loud ah voice, and we'll go low. So I'll do it first. Ah. All right, and we'll try it together. So 3, 2, 1. Ah. All right, and we'll do 2 more. 3, 2, 1. Ah. And we'll try one more. Ah. All right, great. So I know I didn't hear you, but I can see some nice participation. It's looking good in the audience there. So I'm going to share my slides again. And we're going to just do some functional phrases. Let me see if I can pull this back up. Oh. Okay, so now I want you to take that loud voice, and these are just some examples of phrases. If you were in treatment, you would have these personalized to you and things that you say every day, but these are just some common ones that we'll practice just for this demo. So I'm going to think that same loud ah voice and now use it for these phrases as you see them on the screen. Hello. How are you? Good morning. Have a good day. I love you. Good night. What's for dinner? Do you want to watch a show? Thank you. Talk to you soon. Goodbye. All right, so that just walks you through a brief demo. If you were in treatment, you would have those 10 phrases and you would say them 5 times during treatment, and then you would also have those phrases to say at home. And then once you get through your functional phrases, that's when you would go into the hierarchy where you have more complex readings, again, moving from phrases, words and phrases all the way into conversation by week 4. So that just gives you kind of a general sense of what treatment looks like. Again, it would be very personalized to you and your goals, but those are the types of repetitions and exercises you would be doing during treatment. So I'm going to briefly just touch on the research behind LSVT Loud so you know what's out there and how much support is really out there showing that LSVT Loud is really a gold standard in speech treatment for those with Parkinson's. So there's a lot on this slide, so I'm going to try to break it down for you so it's a little easier to understand. But this slide just shows the 3 randomized control trials that have been done with LSVT Loud, and there's actually since been 2 more that have been published recently. But this slide is showing you some of the ones that were previously done. And what we're looking at here, so in each of these different graphs, we see time on the x-axis, so going from pre-treatment to post-treatment to follow-up, so either 6 months or in this first study, it actually went out to 2 years after treatment. And then here on the y-axis on each of these, you see change in decibels of sound pressure level, or vocal loudness during a reading task. And so they were compared to, this first one was comparing LSVT Loud to a respiratory treatment. The next one compared LSVT Loud to a no treatment group. And the third one compared LSVT Loud to an articulation group and a no treatment group. So if it was compared to another treatment, they were matched on the same intensive mode of delivery. So they were both 4 days a week for 4 weeks, daily homework assignments. Us as clinicians, we had to be matching the enthusiasm no matter which treatment we were giving. So the delivery was exactly the same. The difference was the target, whether it was loud or respiration or articulation. So what we can see here across all 3 of these studies is a great improvement in that decibels of sound pressure level, or that vocal loudness, from pre to post, and then also maintaining out to either 6 months or in this case 2 years. And it's not to say it wouldn't continue to maintain or even in some cases improve. It was just that's when the study funding ended. But that's why it is important to continue to practice every single day. But it's really great to see if you do that intensive month of treatment, 16 hours in 1 month, you're also able to maintain those gains over time. Now this slide is really exciting to me. I've been talking a lot about that spread of effects that we see. So we saw it with Shirley, you may have felt it in that exercise earlier on, and the research is supporting it also. So not only are we improving that vocal loudness like you just saw on that previous slide, but we're seeing a spread of effects into many other areas related to the speech production system. So we're seeing changes at the neural level, so changes in the brain, facial expression, articulation, intonation, voice quality, swallowing. So there's a lot of really neat changes just again from that focus on loudness. Now with LSVT Loud, I know it's an intensive mode of delivery, and sometimes there's questions about, what if I can't get there 16 sessions in a month? So there are other modes that have been developed with the assistance of technology to help make that intensive dosage possible. So the first would be LSVT Loud, or telepractice delivery of LSVT Loud, and there's a lot of great research out there supporting that the improvements made in person are comparable to the improvements that are made over telepractice. So that's also an option to receive all or some of the sessions over telepractice. And then the second method that was developed is the LSVT coach. It's previously been referred to as the LSVT Companion. So if you see that in any of the literature or on our website, those were kind of used interchangeably, but we're shifting over to LSVT coach now. And I'll talk to you a little bit about that. It's basically, it's a software program that can be installed on Windows-based PCs, and it can walk clients through either homework exercises or full treatment sessions. And it gives you audio and visual feedback based on the goals that are set by an LSVT Loud certified clinician. So here's the research that was done on the LSVT coach. And what we see here on the x-axis are a variety of different speaking and reading tasks. And then the changes in decibels of sound pressure level, we see pre in purple, post in this kind of peaches color, and then yellow would be 6 months follow-up. So we're seeing some nice changes across these speaking tasks and reading tasks from pre to post to follow-up that are consistent with changes that are reported when all the sessions are delivered in person. So for this study, 7 of the 16 sessions were delivered independently at home using the LSVT coach. And so again, those changes are comparable to when all 16 sessions were delivered in person. So those are a couple kind of methods of technology that have been delivered or have been studied to help kind of help show that you can also utilize technology if needed to make sure that you're still getting all 16 of the treatment sessions. I'm going to just briefly show you a video of the LSVT Companion or LSVT Coach so that you can see what it looks like.
Welcome to a demonstration of the LSVT Companion home or client version. This program can be used by individuals with Parkinson's disease or other neural conditions who are receiving LSVT treatment. The program can be used by clients for their homework practice, or it can be used actually to deliver an entire independent treatment session, either within the clinician's clinic or at home by the client. This is the welcome screen for the program, and the client can choose to display data or not. They'll click Start Exercises and then follow the prompts through the program.
Okay, let's get ready. Let's do those loud ahs. I liked that one. Dig deeper, get louder.
As you can see, the program responds to the client's voice in terms of loudness as well as duration and frequency. And the clinician would have set target goals for each individual client, and if those goals are not met, feedback is given to motivate performance.
All right, so that kind of just gives you a sample of what the LSVT coach looks like. Again, you would work with your LSVT Loud certified clinician so they can set those goals so that it does give you the appropriate feedback when you're practicing independently. So after treatment, no matter how you're receiving it, it's important to take your daily dose of LSVT Loud homework exercises. So with Parkinson's, you know, you have your medications, whatever your routine is for that, plus your daily LSVT Loud homework exercises is going to be the best combination of success to make sure those great changes last over time. So with LSVT Loud, you do your month of treatment and then you continue to practice once a day for the rest of your life to really maintain those gains that you made in treatment. After LSVT Loud, there's a variety of kind of lifelong support to help you through this journey. So again, there's that daily practice every single day. And at the end of treatment, your clinician will give you some type of either a log or a reminder paper with all the exercises spelled out. So you have that daily reminder to keep practicing. We like to say, you brush your teeth, you do your ahs. So it's that much a part of your daily routine. There's also an LSVT Loud homework helper video that's available. That can be available as a DVD or download or streaming. And that's where one of my colleagues, so Dr. Cynthia Fox, is actually walking patients through the exercises. If you like to have someone continue to walk you through the exercises, that can be a nice tool. There's some nice group exercise options. Once you've completed the individual LSVT Loud treatment, you can join an exercise group, and it's just a kind of a maintenance group that meets usually weekly. It just depends who's leading the group. We have them all over. We even are doing them virtually. So I lead a virtual group that meets weekly, and it's the highlight of my week. It's so great to see everyone practicing along. So we go through the exercises, we have different speaking and reading activities through those groups, and it's a really nice way to help maintain those gains in a really positive, supporting social group atmosphere. So on our website, when you look for LSVT Loud certified clinicians, if clinicians have gone through advanced training to lead a group, it will show up in their profile. So you can search for that by going to our website, so lsvtglobal.com. You click on Find a Clinician, and then you type in your zip code or city and state or country, and then you can see if there's any leaders in your area there as well. And then also there's regular tune-ups. So once you're finished with treatment, your therapist should be checking in with you anywhere from 3 to 12 months after conclusion. So just like you see your physician regularly, you see a dentist regularly, we want to be a partner in your journey also. And so we want to be checking in with you again every 3 to 12 months. Sometimes it's just a check-in to see how it's going. If things are going well, you're maintaining your loud voice, you're continuing to practice, we'll say, okay, I'll call you again in 3 months or 6 months. Other times we may bring you back in. So that's what we call tune-up sessions. So, it's usually around 2 to 6 sessions, just to kind of a mini refresher course, get you back into that loud voice. Maybe you need some more calibration practice or getting back in the groove of homework or what the exercises feel like. So we'll keep checking in with you throughout this journey. And then we also encourage other enjoyable activities and fitness for Parkinson's. So whether it's, physical exercise or singing or Toastmasters or a book club, we encourage that as well as you continue on your journey. So I know I've talked a lot about LSVT Loud. I also want to mention some kind of general tips for improving and working through some of the communication and cognitive challenges, especially if you're not able to get in right away. These are just some general tips to consider for you and care partners in your life. So speech treatment you may need increased dosage. So if you're working with a speech therapist already, ask them about LSVT Loud. If they can deliver LSVT Loud with you, talk to them about the importance of that intensive dosage to really get something that does make a difference that lasts over time. And then in general, just trying to reduce distractibility and background noise in your environment. So if you're having dinner at home, making sure the TV is off, or sitting in a quiet room, or closing the door if there's a lot of noise outside, or closing windows, just trying to reduce some of that background noise. And then being patient. So this would be more for family members and caregivers, being patient to allow time for that delayed auditory processing that may occur. It can also be helpful to define the topic of discussion. So it might be earlier in the day, you say, hey, tonight I want to talk to you about the vacation we're going to take with our grandkids this summer. And so that's already on their mind, and it's easier to kind of follow along with the conversation at dinner if that's already been a topic of discussion earlier in the day to lead you into that later. Sometimes it can help to ask yes or no clarifying questions as needed, and then really keep the focus simple of the conversation. So these can be tips for both the individual with Parkinson's and then also those in their environment. Also with treatment of cognitive function. So with LSVT Loud, we do embed some cognitive exercises within the reading and conversation and daily exercise practice, but it's not focused on cognitive function. So you could also certainly get an assessment and treatment plan for improving cognitive function with a speech language pathologist that would be separate from LSVT Loud. And with that assessment, they would identify, personalized interests, habits, and goals. They would also interview family members to try to get a big picture idea of what your current cognitive function looks like and how that can be improved. They'd also look into some environmental evaluations to help determine best locations for communication and kind of best setup of areas for communication. And then they could offer direct cognitive rehabilitation, so certain exercises to help with cognitive training. And here are just some general tips for kind of early to mid-stage cognitive health. So the American Heart Association recommends exercise, so just getting in a good exercise groove, just like we encourage that for the voice. It's good to do it for the whole body, so even a daily walk, something to get exercising on a regular basis. Staying socially active, so there's lots of great Parkinson's support groups all around the world, but it doesn't have to be a support group. Again, it can be something that you really love, so your volunteer group or a book club, a singing group, whatever it is that you like, just staying socially active. Working your brain, so you can certainly participate in some of those cognitive exercises, even in the newspaper or kind of booklets with, word searches or word finds or numbers games. So just trying to work out your brain. Learn some coping strategies with your speech or occupational therapist to help with that also. Nutrition can also affect cognition, so consulting a nutritionist, making sure that you're on a good eating plan to meet your needs. And then also just taking time when doing tasks, so not feeling rushed, not letting others rush you, so that's good for others to consider too. Taking time, trying not to be stressed or in a hurry when going places, but allowing the appropriate amount of time for doing tasks. I'll also talk about some device-based aids that can be effective. These are most effective, and we would recommend using them in conjunction with a speech language pathologist to assess if it's appropriate for you, and then also treatment to make sure that you're using it correctly. So as you can imagine, I always would advocate for intensive treatment as an approach to really empower the patient with Parkinson's to be able to take back their voice and use that loud voice on their own without the need for an external device. But there are certainly situations when a device can be used and can be helpful. So that's what I'll walk you through here on the next couple of slides. So some personal amplification devices could be used. One example here is a boombox. And so that would be a portable microphone and speaker system to amplify or boost your speech. And so again, with that, it'd be appropriate to work with your speech language pathologist to see if they they could assess and treat you with that to make sure that it's used in the best manner. The LSVT coach that I showed you earlier can certainly be used, but that would be in conjunction with an LSVT Loud certified clinician to make sure that it's set appropriately for you. The Speech Easy is a device for delayed auditory feedback. So it goes in the ear similar to a hearing aid, and it's designed to reduce hyperfluent speech. So there's a slight time delay. You hear your own voice, but there's a slight pitch and time difference. And then it recreates what's called the choral effect. And so what that means is that then you're speaking in unison. So that's what a choral effect would be, speaking in unison. So you're speaking in unison to help reduce some of that hyperfluent speech. The speech Vive was developed for individuals with Parkinson's, and that can increase vocal loudness using what's called the Lombard effect, or by playing noise. It's like a babble noise in your ear when you're speaking. It makes you speak louder because you're hearing that noise in your ear. So that helps you speak louder by having that cue in your ear, and it doesn't play that sound when others are talking so that you can easily listen to others. And then there's other augmentative devices, alphabet boards, picture boards that can be used. So again, if you think some of these may be helpful to you, I would definitely recommend consulting with the speech language pathologist first, and then they can help assess and treat you with an appropriate device if that would be beneficial. I mentioned singing before, so there's some research on singing that describes singing protocols to address speech and voice goals, but what we're seeing in the research is that singing doesn't replace speech therapy. So we say to use that complementary. So it's certainly a fun activity. It's enjoyable for people. And so if you like to do that or you want to do that on your own, that's definitely something to look into, but just know that research doesn't support it transferring into kind of your daily speech and voice patterns. So that would be just use complementary or in conjunction with treatment that's focused specifically on helping with your functional communication. But we also know that there are social and therapeutic benefits of music and singing. And then there's also some Parkinson specific singing groups. So there's one here on your slide, the trembleclefs.com, that you could look into as well if you're interested in that. So I'm reaching the end here, and I want to make sure that you know some action steps so you know what to do next. So the first is just to recognize. So recognize that your speech may be changing and you may not notice it. So we say don't wait for treatment. The earlier you get in, the better. Even if you're not really noticing that many changes, we can make a big difference even very early on in the course of the disease or early on before there's that many voice and speech changes. So get an assessment and treatment plan with a speech language pathologist. So we say to find a speech language pathology professional. You can do this through your neurologist or physician, or also we have some websites where you can search for local SLPs in your area. And then learn more. So every Parkinson's organization has free resources on speech, which I've talked a lot about today, cognition, and also swallowing. And then we say engage in intensive treatment now, and then keep engaging. So keep practicing when treatment is over. Utilize device-based aids and communication strategies as needed in conjunction with behavioral speech treatment, and then keep participating. So we really encourage you to keep participating in what you love. So singing, Toastmasters, which is a public speaking group, your exercise classes, book clubs, look into some that are virtual if you're not able to go in person still, and just in general, talking with family and friends. So continue to participate, be a part of that conversation. If you're interested in finding an LSVT Loud therapist, you can go through your doctor and get a referral for and a prescription for an evaluation and treatment. And then I was mentioning before, if you go to our website, so lsvtglobal.com, and then find LSVT clinicians, that's where you can type in where you live and see if there's clinicians in your area. Keep in mind, as I mentioned, you can also get telepractice delivery. So if there's none in your area, you can also look into that option. If a clinician's been gone through advanced training to deliver LSVT Loud via telepractice, it will show up in their profile as an LSVT Loud provider. And as you're trying to find an LSVT Loud clinician, we just have a few questions to ask them. So making sure they're delivering the gold standard dosage. So it's important, really important for your outcomes that it is 4 days a week for 4 weeks, 60-minute sessions, and they're including daily homework and carryover exercises. just getting a general sense of how many clients they've had and what their outcomes are, and if they have a follow-up or maintenance plan for their clients. On our website, so lsvtglobal.com, we have opportunities to learn more about speech in Parkinson's and also mobility in Parkinson's. So we have a library of webinars. We have sections on our website dedicated to patients and family members. So feel free to check that out. I think some of those will be posted in the comments, so you can click on a direct link to those, but we're here to help you and support you and guide you. So we want you to engage with us, and we're happy to share what we can with you. So I know I went almost to the end, but I'd love to take some questions if there have been some questions that have come through. So thank you so much for listening. It's been great to be here with you today.
Hi, Beth. Thank you so much. That was not only informative, but you gave such great information for people to actually get up and do something for speech therapy. So a couple of questions came up. Some of them that were in the chat you answered as you went along, but there was one was about Coach. Does Coach work on a Mac with a Windows simulator program like Parallel for Mac, or is it confined to just Windows programs?
Yeah, so that's a great question. So it's been, we basically have support for Windows-based PCs. So we have actually one of our faculty instructors does use it on a parallel program on Mac. The only issue would be if there was some type of support issue that came up, we would definitely try to help with it, but the support that we have and have tested and gone through is with a Windows-based PC.
Okay, thank you. Let's see, I'm looking at another question, and it's about insurance coverage for the therapies. Can you talk a bit about that with Medicare and also private insurance?
Yes, so we have great success with insurance reimbursement, whether it's Medicare or private health insurance. So just depending on how your insurance kind of goes about it. That's why it would be important to talk to your neurologist or physician first. Then you could get the prescription in and then get that referral for an evaluation and treatment. And usually, a lot of clinics are great with working with their billing department and making sure they'll go over the coverage with you, but we've had really great success in getting treatment reimbursed. Some insurance companies, there is a copay. Others, it's fully covered. So the big answer is yes, it's reimbursable. It's just important to work with your speech therapist and the billing department just to make sure that it's covered before you get into treatment, and then make sure you're aware of any copays if you do have copay, for example, for if you're seeing it in outpatient.
Okay, that's great. We had a question. We had someone who has hearing aids, which makes them feel like they're speaking loudly already. And I wanted to add on to this. I bet there are some of us who have tinnitus too. How does that affect the voice?
Yeah, so the research is showing that, individuals with hearing loss or without, we're seeing this sensory impact no matter what. So there's always this feeling of speaking too loud, even if it's not too loud. So through the process of calibration and treatment, your therapist would work with you to realize, yes, even though it feels too loud, and it might not be, or it might be related to the hearing aid, you need to get at this level for others to hear and understand you. And we talk to clinicians about certain techniques that they can use to help with that. For example, a lot of times we'll record and play back parts of a session. So I'll ask a patient, so I'll record them and I'll say, how did that feel? And they'll say, oh, I'm shouting, I can't talk like this. And I'll say, well, let's just listen to it. So we play it back on the tape and they'll say, oh, I sound great. I thought I was shouting, but that's not shouting. So it's that calibration piece that's going to help whether you have hearing loss or wear hearing aids or not. It's getting used to the effort that it takes to produce that voice that's within normal limits. And so through that calibration process over the course of treatment, we help people recognize what it should feel like and how it should sound so that they use it out of treatment.
Perfect. One question, our latest question, can you briefly touch on loss of executive function and its impact on speech cognition?
Yeah, so that can certainly occur with Parkinson's disease, and we talked about some of kind of the cognition factors that can occur. And so again, with that, you could certainly get kind of cognitive training and a cognitive assessment to see what's occurring and what strategies could be used, and then also what kind of exercises can be used. With LSVT Loud, what we would do with that again is keeping that focus simple. It's repetitive, so we have multiple repetitions of the exercises. The focus is just on loud, and so that we don't have to bring in too much extra kind of cognitive effort to get some nice results. And then there also might be cases where we might use the environment or caregivers to help us with some appropriate cueing when needed at home, because we do have some patients who won't be able to get to that that level of using their loud voice in everyday conversation. But it might be that now they can use their loud voice if they have a cue from their environment, or so maybe their spouse says, tell me that in your loud voice. And we train caregivers on what would be appropriate cueing if needed at home or in a different environment as well.
Okay, that sounds like something that the whole family could work on, everybody in the household. Okay, well, that is we're right on time. It's 1 o'clock. Just want to tell everybody before we sign off, if you haven't been to the pmdalliance.org website, I really encourage you to get in and just dig around. There's all kinds of resources, from listings of support groups to activities to our NeuroLife online video library. Just explore our website. You're going to find a lot of things that will be of interest and supportive to you and your goals. And the other thing is, when you're at the website, sign up for our emails. Many of you, I'm sure, already have, and that's why you knew to come to this presentation with Beth today. But if you came just because you saw something about it, if you go into our website, pmdalliance.org, you can choose what news announcements and letters you would like to receive specific to your area and your interest, so that you will be reminded in your email, like we all were today, that this presentation is going to happen at noon. So you can keep track of the different offerings that we have for you. Otherwise, just stick with us. We've got great stuff coming up every week. Everything from online support groups to special presentations by professionals like Beth and movement disorder specialists. We have great discussions in our support groups. So please join us for our social programs and our support groups, as well as the great informative things that we can offer you, as we offer you support and encouragement and hopefully some motivation to just get out there and do all you can to make your life as good as it can possibly be. So thanks very much. We hope to see you again soon. Thank you so much, Beth. What a pleasure. Great.
Yeah, thank you.
Bye.
Bye.